Hi, I'm Dr. Andy Evans, Deputy Director for Clinical Services at the Rutgers Cancer Institute, and we're thrilled to be at ASCO 2024 in Chicago. And I'm really happy to be here right now with Dr. Omene, one of our medical oncologists and breast cancer experts here. Great to have you.
Thank you. It's great to be at ASCO with everyone this year.
And Dr. Omene has a busy meeting. She is a co-author on a couple oral presentations, which are tough to garner at these big annual symposiums. And the first one I'd like to ask you about, now I know it's a late breaking, so we can't get into any details, but it's one of the I-SPY trials. Could you maybe just tell us about I-SPY in general, and then obviously this particular presentation a little bit?
Sure. So for those who may not know, I-SPY has been around for many years, since about 2010. And it's this very smart trial, adaptive in design, designed to investigate promising agents to quickly look at the efficacy in the neoadjuvant setting for breast cancer, for early stage breast cancer patients, in its treatment strategy designed, personalized to their particular tumor. And so over the years, this I-SPY trial has actually graduated a number of drugs that we use as standard of care today. And in this meeting, we actually have some results from I-SPY trial, looking at a couple of these investigational agents, which will be shared with later in the conference.
Great, we look forward to that. And in addition to being a breast cancer expert, Dr. Omene also has a keen interest in disparities. She is a program director for breast cancer disparities research. And there's another presentation that I know you're a co-author in. It was actually a Vizient database analysis of more than 2 million participants looking at A, clinical trial enrollment, but B, disparities and vulnerabilities. Could you maybe tell us a little bit about that?
Yeah, so this is a collaboration with Dr. Purati, Dr. Eskander, where we looked at social vulnerability and the impact on clinical trial enrollment. And as no surprise, this is a big an issue in oncology that we have to address. And they did find that Black patients were located in the highest social vulnerability quartile. And that had an impact on their clinical trial enrollment. And the key areas that needed to be addressed and intervened on included issues with transportation, education, and neighborhood resources. This will be presented later in the conference as well, so I hope everyone tunes in.
And lastly, that really is a nice segue to some of the efforts we are doing at the Rutgers Cancer Institute, and you specifically, to address disparities in cancer care, in particular clinical trial enrollment. And when you look at all clinical trial enrollment for minorities, it's hard to believe, but Rutgers is near 50%. Now that does include Asian populations, but that really has been a big increase, and we're not where we need to be. Maybe just a little note on some of the efforts and work that you're doing to address that.
Yes, and so this is a big mission at our institution. I think it's a mutual decision that everyone knows is of importance, great importance, and everyone is contributing to this effort. And so what we do as program director for breast cancer disparity research in our disease group, we make a lot of efforts to design trials and conduct research projects, specifically asking questions designed to hopefully intervene on areas in the Black population and their biology and their outcomes and how they respond to treatment. So that is a big mission. The more that we can open trials designed for this population, the more we can make an impact. And we also, hand in hand, do a lot in outreach within our network as well, where we engage not only the physicians, but we also engage the patients. We do town hall series where we talk directly with the patient population, address their questions, and then we find out areas where we can, and barriers that we can all work towards addressing, all in all to increase clinical trial participation at our institution.
Fantastic, and so good to talk with you. Fantastic work you're doing, and hope you have a great meeting.
Thank you. My pleasure. Thank you.